Hello students, today we will talk about steroidal drugs. Steroids are the family of compounds that contain 1,2-cyclopentano-phenanthrene ring system with a side chain of varying length. The rings A, B, C are 6-membered and the ring D is 5-membered. The sequence of numbering is shown. Now the group attached to any position, which will be shown by a continuous thick line, is considered to be above the plane and will designate it as beta, and the group which is shown by dotted lines will be taken below the plane and it is termed as alpha. Nearly all the steroids are named as derivatives of cholesterol. So we have this different arrangement. As you can see in 13.3, 4 and 5, we will see the structures one by one. Let us talk about first the sex hormones. Sex hormones are steroids. They may be classified in the following groups according to their chemical structure and the physiological activity. So we have estrogenic, that is female, progestational, that is female hormone, and androgenic, that is male hormone. Let us talk about the first estrogenic hormone, that is estradiol. As we can see, the brand name is Estress or Progesterone. Now the chemical name, we have 17 beta estra 135 10 trine 317 diol. The physical properties, it is available as creamy white odorless hygroscopic and crystalline powder which is insoluble in water, soluble in alcohol, and sparingly soluble in chloroform and ether. Now this is stable in air. Melting point is 173 to 179. The 317 beta diol formation can be esterified to give derivatives with greater increased oil solubility for the extended period of action as compared to the parent compound. Now the most prevalent use of estrogen is in combination with progestin in the oral contraceptive preparations and the treatment of menstrual disorders. Estrogen are used as replacement therapy in ovarian failure or at menopause to prevent osteoporosis and to relieve the symptoms of estrogen deficiency. They are also used as androgen antagonist in certain cancers. So the dosage for oral replacement therapy 1 to 2 milligram per day for 21 days. For breast cancer, 10 milligrams thrice a day for at least 3 months. Prostatic cancer, 1 to 2 milligram 3 times a day. Let us talk about progestins. The second hormone produced in the ovaries is progesterone, and this is formed from the steroid precursors in testes, placenta and adrenal cortex also. This is the hormone which is produced in the corpus luteum and that stimulates the development of secretory endometrium in the later part of the ovarian cycle. Now this progesterone is essential for maintenance of pregnancy, and once the implantation occurs, the luteal function is assumed by the placenta. These progestins are primarily used again in oral contraceptive preparations, and they are given along with the estrogen for the treatment of menopausal problems. Also they are used for the treatment of infertility, secondary amenorrhea and dysfunctional uterine bleeding. They can be used as adjunct in the treatment of endometrial carcinoma. Some progestin have been used to treat hormone sensitive breast cancer and to improve appetite and stimulation of weight gain in patients with AIDS-induced cachexia. Now we talk about progesterone. This, as you can see the structure, this is pregnine 4 pregnine 320 diol. Now this is available as white odorless crystalline powder, insoluble in water, soluble in alcohol and acetone, stable in air. The melting point is 126 to 131. Now the natural progesterone has half-life of only 5 minutes, so it is difficult to have the therapeutic utility. However, the semi-synthetic derivative of progesterone are used in the oral contraceptive formulations. We have intrauterine contraceptive device, that is Progestin, which contain progesterone in the silicone oil, and that is able to release the hormone in 1 year. So the dose intramuscularly 5 to 10 milligrams a day for 6 to 8 days for primary and secondary amenorrhea. The dosage forms: injections 250-500,000 milligram per 10 ml, and intrauterine contraceptive system 38 milligram in silicone oil. The storage is airtight, light resistant containers. Let us talk about androgens. The testes have a dual function to produce a germ cell, that is a sperm, and also to supply the main hormone, that is testosterone. Now this testosterone is formed in the Leydig cells under high integrated system involving hypothalamus and pituitary. The testosterone and the active derivative have two actions. One is androgenic and second one is anabolic. Now these androgenic actions are responsible for changes associated with the sexual maturation and stimulation of spermatogenesis. So they're also responsible for growth at puberty and increase in the muscle mass. They stimulate the growth and secretion of sebaceous glands and the growth of facial hair. So androgens have been used in hypogonadism in the male and certain type of infertility. Testosterone propionate is also used in the treatment of metastatic carcinoma of breast. Anabolic steroids are widely misused by athletes or bodybuilders who want to increase the muscle weight. They have limited use in the treatment of osteoporosis. Let us talk about testosterone. As we can see the structure, this is 15 beta hydroxy andro 4 in 3 one. So this is slightly creamy white crystalline powder, insoluble in water, freely soluble in chloroform, and sparingly soluble in ether. So this is stable in air with the melting point 153 to 157. This is not effective orally. Plasma half-life is 10 to 20 minutes. So the esters like propionate are prepared. The dosage: intramuscular male hypogonadal states will be given 2 to 3 times a week, 10 to 25 milligrams. In the metastatic breast cancer, 100 milligrams 3 times a day. As we can see, many dosage forms are available. That is testosterone cypionate, testosterone propionate, and injections 100-200 milligram per ml.